have well, Boomtown have so, and I'm sure Anna will talk about that. But I think without the input of the committee, many in the sector would have been left out of the pilot events program on the safe return of audiences as well. And obviously, you saw one festival that the download this weekend, which was good to see. So it was made very clear to us in evidence, James, that the majority of music festivals just don't have the financial resilience to cover the cost of yet another year of late notice cancellations when they're on the hook for many costs. So if the commercial insurance market won't step in, and it won't, we say and still say that ministers must, and urgently, events need to know whether the government stand with them or they simply won't take place this year. We've seen so many cancelled already. When we repeat our call on government now for an insurance scheme to cover festival organisers if events need to be cancelled as a result of the COVID restrictions beyond the 19th of July, now described as a terminus day. So there is still time, but there really is no room for any more excuses. The inquiry also looked at some of the structural and the long-term challenges around the impact of the UK-EU trade deal on travelling artists and its impact on talent, environmental impacts of festivals. We looked at that. Ticket touts, we touched on that briefly, and I was very keen because I knew Fiona and I've seen the loop in operation that obviously we talking about the dangers of illegal drug use at festivals. So just to touch on the three areas then briefly. So I've talked a lot about lacking the support. We think the sector revenues have dropped by about 90% this year. More than a quarter of festivals with over the 5,000 capacity, including Boomtown in Hampshire and Blue Dot in Cheshire, who we heard from, have cancelled for another year for their full festival anyway. And without the backing of large transnational companies, the smaller independent events that account for most of the festival sector, of course, they just can't take the financial risk in the absence of this assurance. And so that was the kernel of the report, and that's what got the headlines. There was a lot about environmental targets, and I think there is a big challenge for the festival sector around that, and the report talks a lot about that. We called on both the government and local authorities to do more, working with festivals to reduce their environmental impact through the licensing system and through the SAGs, rather than letting the sector continue to mark its own homework. And many in the sector may disagree with that recommendation, but I think we had a lot of evidence given to us that said that. We had Massive Attack, and so Robert from Massive Attack was an inquiry witness. He said that he was quite livid at the lack of meaningful activity to reduce emissions from live music. And so there's a lot about that in thing. And then finally on legislation to improve drug safety. So the report highlights a concern that compressed festival season last year, such as it ever happened, and this year, and the likely circulation of high strength drugs could lead to a real spike in drug-related deaths at festivals this summer and next. Fiona made that point to us very clearly in evidence. So we call on the government to amend legislation to enable drug checking services to operate lawfully, such as those operated by the Loop, which conducts obviously the front of house multi-agency safety testing, the MAST. Evidence that we have in our report suggests a 10 to 25% reduction in drug-related harm where the Loop operated on site. So the Misuse of Drugs Act 1971 considers the possession, supply or production of any amount of controlled drug without a license where one is needed a criminal offence. This means that MAST services rely on the police not enforcing the law when substances are handed over for testing, which the National Police Chiefs Council lead for drugs described as a no man's land where policing is stuck in the middle. And the committee heard about New Zealand's plans to develop a regulatory system for drug checking, and we recommend that the government here introduce a dedicated licensing system for drug checking, setting a clear legal framework and minimum standards that providers must meet. And in closing, I'd say this, I have seen the dangers of drugs at festivals, and I have met with the parents who've lost children at festivals. If we believe, and some do, that this is all about coming down harder and a criminal justice response, then we will continue to get the same answer, and more MPs will continue to meet those parents. We have to face the reality of society as it is, and I have seen Loop in operation at Boomtown, and I think it is absolutely fearless and brilliant what they have done. And there is no question that it has saved lives. You know, I've seen the work, Fiona, that you've put out, that more than 90% of participants who completed the follow-up survey to your drug checking services said that the intervention influenced their subsequent behaviour. So there is strong evidence that the loop is having a long-term impact on behaviour. And for many young men, probably in particular, it is, as you said to us in evidence, Fiona, it is one of the few interactions with some sort of medical professional that they will have. So I look forward to hearing more from Fiona during this. We enjoyed hearing you as part of our inquiry, Fiona. But in summary, James, that is what our inquiry report found. It's obviously available on the committee website if people want to read it in more detail and all the evidence that led to it.
Thank you very, very much for that. So yeah, that's a really useful overview of the report. And actually, while we were speaking, I did post the link to the report in the chat so that everyone can have a read of it, which I would recommend. Really interesting findings in there. And I'm sure we'll come back to some of the finer points of it later as well. One thing I actually forgot to say in my introduction is we do welcome questions from any of the attendees. So we've got a chat. We've already had one person entering a point there. We welcome everyone to type in their points. We also have a Q&A there where people can pose their questions there. And I would hope, if you put a question there, I would hope to pose them to the panelists while we are all here today. So next, I will introduce Anna Wade, who, as I'd said, is the Communications and Strategy Director for Boomtown Fair. So Anna might well have some follow-up points on some of the points we heard from Steve some moments ago. I think mainly, Anna, I'd like to ask partly a small amount about the challenges already faced in these 2 lost summers so far, and also perhaps what you can tell us about what it will be like trying to relaunch festivals, whether you call this during COVID or a post-COVID situation, how you think they might change, what we should expect for the remainder of festival season 2021, and what you expect us to see in festival season 2022.
Lovely. Thank you, James, and hello, everyone. And thank you, Steve, as well. That was such a really insightful overview of all the hard work and the incredible investigation that the DCMS Select Committee actually did with the Future of Festivals inquiry, of which I was incredibly privileged to be part of as well, and to give evidence in terms of the future of festivals, covering all those topics that Steve has just highlighted, and actually really getting the opportunity to kind of really dig into just absolutely what the situation is for festivals currently and how devastated our market has actually been through COVID. So I think that, you know, to answer the question of relaunching during a COVID world, I think we've all seen with the roadmap, there was a fair bit of positivity around it to begin with. Actually, like when it was first announced back in February, obviously Reading and Leeds announced that everything was back on and it was all going to go ahead, and we all saw an amazing influx of excitement and joy, and I think everybody really looking forward to. I think some people had dubbed it the 3rd summer of love and things like that. So I think that everyone was really, really ready for that, because obviously we've all been in lockdown for so long, and we just need that connection and celebration that festivals bring for us. As we've gone through the roadmap, it has obviously changed a bit, and as Steve announced, mentioned earlier, the 4-week delay has been devastating for a number of festivals. We saw Kendall Calling having to pull immediately. I think we've seen Truck Festival, no, not Trucks, Tramlines or Truck. There's been quite a few other festivals since then that have then had to make the decision to pull, unfortunately. I think that in terms of the rest of this summer, I think that actually there is a bit of positivity. I think that those ones that are a bit further away from that 19th of July deadline that we're now looking at, everything is still quite unknown, but if the government does stick to its guidelines, and if the social distancing and the other mitigation measures are removed, then we may actually still get to see a bit of the summer, and I think a bit of the summer could still be saved. So I don't think all is lost at all. It does mean that for a festival point of view, everything is just so unknown. We're very used to dealing with unknowns and having lots of things thrown at us at the very last minute. We're all very quick at being quite adaptable to different situations and horizon scanning and risk mitigation. But when you're in a world such as the world that we're in at the moment, with so many unknowns and so much out of our control, it is very difficult, and it's quite a hard thing to preempt. But I think that one of the things that has happened is when we were giving evidence to the committee, we all outlined a number of things that would be really, really beneficial to help festivals kind of move forward with this summer. One of those was the extended Cultural Recovery Fund, which the government did do, and as Steve mentioned earlier, Boomtown were a very grateful recipient of that as well very recently. So that has thrown an incredibly vital lifeline to a lot of festivals, cultural venues, and the whole culture industry as a whole. I think specifically for festivals, those of us that have received it, that lifeline is so important, but it isn't the complete solution. It's not the silver bullet that will absolutely help everybody. I've been saying it's a bit like the old saying of give a man a fish and he can eat for a day, or teach him how to fish and he can feed himself forever. And whereas the Cultural Recovery Fund absolutely managed to help us recover from the loss of the 2020 events, the insurance really is the silver bullet here. Really, it's the thing that will open the door. It will mitigate all those risks that Steve's alluded to already, that will really help festivals actually move forward and give us the autonomy to make those decisions ourselves and take those risks, because we'll have that safety net. So I think in this stage where we're at right now, that really is one of the most important things that we would be very grateful to hear from the government on. I believe it was announced from one of the culture ministers last week that actually it isn't fully off the table and that they are looking into it. And Steve may know a bit more about this than I do, but they are still looking at it, and it could potentially come back onto the table, which for those of us that are still looking to hold some kind of event in 2021, that would be the absolute thing that can enable us to do it without potentially bankrupting and ruining our entire organisation's future. So I think that really is one of the most important things right now. Another one of the things that we asked the committee for was no later than dates. So that they did also provide that within the roadmap, which was incredibly welcomed as well. So there was a lot that the government has done to help remove some of this doubt and the risks that are involved. But as Steve pointed out, and as the report found, it does feel that festivals haven't really been treated in quite a similar way to some other areas within cultural kind of departments. So I think if we look ahead for 2021 and where we're at right now, what we're expecting is very, very, very difficult question to answer, if I'm honest, because it all very much depends on what is announced from the 19th of July. And it also very much depends on what is released from the events research programs as well, which we're hearing anecdotally that these have actually been really quite positive, and that there's been quite a few good kind of results coming from them, but that hasn't been published yet, so we don't know the actual findings fully. But I think that being able to have the Download Festival pilot go ahead last weekend at 10,000 capacity is very it's very heartening for many of us, because as Steve mentioned, I think earlier, the initial event research programs weren't actually including any festivals, and that was down to the work that the DCMS Select Committee did, as well as other organisations such as the Association of Independent Festivals, to really push to try and get festivals on that agenda, because they were just essentially overlooked initially. So to have the Download pilot go ahead is really heartening, and I think that hopefully quite a lot of lessons will be learnt from that, as well as the Sefton Park ones back in May as well. So really for 2021, we're just waiting to see what the results of those will be, and the findings, and therefore the recommendations for festivals. I think from a Boomtown point of view, although we're not actually running Boomtown this year because we cancelled that back in April, we are looking to run a much smaller, kind of really tiny local version of it, just a fraction of the size of the usual Boomtown. So we are still actually kind of in the game, in the way of like really trying to understand, even if running a much smaller mitigated risk version of our event is still possible or not. And we don't know at the moment. It is looking quite positive. It really is. I think that, like the fact that it has been extended for an event in August, it does put us in a much better position, because we'll understand what the this new Delta wave is looking like, and we'll hopefully have a lot more stats and figures to be able to guide us, as well as hopefully solid government guidance as well. So that's another thing. So the things that we're really waiting for that would really help is the insurance to be able to help us unlock and put those deposits down, help support our supply chains, and actually really just push forward with the momentum of doing it. There's also the aspect of fully understanding what the guidance would be and what we're looking like. What does running a COVID secure festival look like in 2021? I think that those really are the key elements. There's also another aspect of it, which is with regards to the localized lockdowns, which we saw a lot throughout last summer. And if there's going to be a similar kind of situation this summer, a lot of the responsibility was actually devolved into the different regions and underneath the local director of public health. So they have a huge amount of responsibility in this situation as well. And last year we saw the last minute cancellation of the Southampton boat show, which caused quite an uproar within the industry, because it was very last minute. And that has kind of given everybody, I think that kind of took the wind out of our sails, to be quite honest. Excuse the very awful pun there, I guess. But I think that was quite difficult, because you're looking at even more risks on top of risks that you're taking, and it's very much out of your hands. So we're actually working really closely with the local director of Public Health's office to make sure that we're just in constant dialogue, and that we really understand what the lay of the land is as we go through these steps, as things become clearer, as we understand what the mitigation measures will be, if there will be a full removing of social distancing and COVID like safety measures. So there's a lot of unknowns, but there's also a lot of things that we know that we can benchmark along the way to kind of help put us in the best possible position to be able to run a successful and safe event in 2021. So that's where we're at right now. 2022, as you've asked us to speak about as well, is we don't know, to be honest. I think that if we use this case in the scenario that everybody is fully vaccinated, that we haven't seen any variants, and that actually life as we know it has started to kind of edge back to normality, whatever that will look like post-COVID, then I think that we could hopefully have the summer season that we're all hoping we were going to have this year. I think that the festival landscape may have changed a bit. We've still got to get through this summer to understand really what the end of furlough will look like, to understand how many events can actually go ahead for the remainder of the summer, and what effect that has on the industry, and primarily the independent sector as well, because obviously the UK festival industry is made up with quite a few multinationals and large corporate companies that can bankroll and back quite a few of the festivals in this country. However, for the independents, when we generally only have one show, one product, one event that we put everything into, the risks are so much higher, because we're going it alone essentially. So I think there's still quite a lot of unknowns out there as to how this summer will pan out and what that effect will then have on the industry going forward. And I think that especially with regards to the ending of furlough position, furlough has been an absolute saviour for all businesses and countries and companies across the country, and that coming to a definite end at the end of September. From a festival point of view, if there aren't any industry specific kind of additional support packages, that could essentially decimate the whole industry, because especially for those that haven't received any cultural recovery funding, those that haven't been able to go ahead this summer, there could be this huge gap where those organisations could drop through. So I very much hope there's more conversations that will be going on to see that. I think they are already bubbling away anyway. So I think that's one of the risks, but there could also be, if the insurance gets put in place and COVID becomes more endemic and we're all just learn to live with it and life does get back to normal, I do think next summer will be one to remember, that's for sure. So hopefully I'll leave it on that positive, which is I think what we're all hoping for really, isn't it? So
Thank you very, very much for that, Anna. And yeah, I just think I found out this morning, actually, via a WhatsApp message that you were going to try. Some friends of mine had asked me if I wanted to try and go to your mini one if it were to happen. And yeah, so very well done for trying to get something up and running in this, what, 6 weeks notice, something like that. So wait, all the best of luck for that. And yeah, lots of points I'll definitely like to follow up on later from that. Next, we'll move on to hearing from Verity Smith. So Verity Smith did research, I believe, more kind of back in the festival landscape we remember. So Verity did research onto the issue of policing drugs at festivals and police decision making. I believe you've got a bit of a presentation you will make on that. So yeah, Verity, thank you very much for coming. I will pass over to you.
Thank you. 1 second. Sorry, just get my presentation up. It's going ahead. Hi, I'm Verity. I'm a researcher at Durham University. I've been looking at drugs and music festival policing for the last 4 years, and I want to sort of draw on my research to make the case that why it should be an important part of the conversation to respond to some of the concerns that Steve highlighted. Just to give you a bit of background, it sort of goes without saying really that there's a long-standing association between festivals and drug use. Recent research sort of indicates that they are spaces of atypical use, initiation, experimentation, and that they're a really important part of the experience for the majority of some audiences. There's also an important relationship between the settings in which drugs are used and the harms that arise. It's called the sort of risk environment can influence behaviour, drug using behaviour. And research from Australia has looked at different festival policing approaches and found that enforcement can increase the harms or potential harms arising from drug use within these spaces. So it makes the case that it's important to think about policing when we're thinking about harms. But at the same time, festivals have sort of set a precedent of being innovative spaces for drug policing approaches. The police were really integral in spearheading the loop pilots, for example. So there's sort of a lot of tensions within these spaces. So my research sort of aimed to fill in some of the knowledge gaps within these spaces and really just try and understand why drug policing happens as it does within these spaces from the perspectives of those who implement it. So the aim is to understand festival drug policing policies as they're negotiated, justified and understood between agencies. And I'm understanding policing here as more of a security pursuit rather than strict law enforcement. So that means efforts intended to keep people safe within a space. And as part of the study over 2018 and 2019, I conducted ethnographic observations at 8 festivals. So there were 6 different festivals with 2 repeated. And that involved 200 hours of, or more than that really, including time, living in the festival, of non-participant observation alongside security, police, management, welfare, and drug safety testing where they were present. And it also included some semi-structured interviews with key stakeholders. This is going to be a very, very whistle-stop tour of key findings. I've approached the thesis in terms of the different approaches that were sort of consistent across festival sites, but with varying degrees. So following some official festival policies, the first sort of major approach that I found was the prevent approach. And this involves efforts made by festivals to deter and detect drugs at the gate in order to reduce the quantities brought on site. And it involves the use of sniffer dogs, amnesty bins, searches. I won't say that they were totally redundant. They did find some drugs, probably more than would be found without them. But I think this sort of summarizes it quite nicely. One participant described them as a PR exercise. And I think this really points to their major symbolic role beyond the stated function that they perform. It's about satisfying the police, the local authority, that they are doing something to find something to keep the police happy. Symbolic doesn't mean useless as well. They also had an important role in, for example, influencing audience behaviour. So it was an important part of drug policing, but in terms of reducing the number of drugs being taken, it was acknowledged to have a marginal impact on the level of drug use within festivals. The second pillar is pursue, and this really is concerned with finding suppliers on site, but not all suppliers, more the ones that might have malicious intent. So it's about people, as this quote says, who look out of place or have come over the fence, because those are the suppliers that would be more likely to be involved in tent thefts or more likely to rip off customers and sell them sort of dodgy drugs. And security conduct like ongoing surveillance throughout the event, and it's a sort of race against the clock to find them before they've got rid of their supply. And within this pillar, actually, there was this sort of deprioritization of possession, as in use and possession of like simple possession. So unless drug use was blatant, it was not actively policed. And then the third pillar is protect, and this refers to multi-agency efforts to help drug users who need it get the attention from welfare and medical services. Security really, really important in facilitating protect. They're often the first response, they're the eyes and ears of the festival. And good partnership work that involved effective communication meant that risks were identified at an earlier stage and could be therefore responded to earlier and more effectively. This is, I think, one of the really important roles of drug checking that is not often emphasised enough. But what I think what this quotation that I've included really speaks to is that it's also a product of negotiation, because everyone has to work together, and this actually comes from a police officer during a negotiation for a drug alert, and he said, you know, if you have the messaging that says take a lesser amount, we can't retweet it. Our line has to be zero tolerance because we can't be seen to encourage use. So it's harm reduction, but it's negotiated to satisfy a range of agencies. So to give you an overview of some conclusions that I've drawn from this research, primarily drug policy, rather than being a set of rules that are followed to the letter, it's more of a living instrument. And what I mean by this is that it's subject to negotiation, it's contextual, it adapts in response to emergent risks because it has to be. And it's also implemented between people all working together with different objectives and occupational interests. So it has to be negotiated. The second point is that low-level drug possession is mostly depenalised. I think this is quite interesting in how it links to some of the arguments raised around the loop about decriminalised zones or tolerance zones, because from my perspective, low-level drug possession is depenalised anyway. Drug policing on site is more, I think, about controlling territory than necessarily reducing drug use. And that really relates to the second pillar, pursue. It's about the kind of people that you want at the festival and the potential harm that they might create rather than necessarily the act of drug supply. My research really highlighted the importance of good working relationships in facilitating information sharing to respond to risks sooner. Where there were conflicts or tensions within relationships, this slowed things down. And thinking about the difference between risk mitigation and harm reduction, Anna and Steve both talked about risk a lot, and I think that really speaks to risk being a more broad concern. There are legal, commercial, reputational, political risks that festivals have to balance with harm reduction. And I think that can mean that harm reduction can be secondary to those risks. And that shouldn't always necessarily be the case, but it means that we have this sort of situation where we might have harm aggravating policies at the gate and then harm reducing policies inside. So speaking to the brief, the future of festivals, I think the most important way that we can tackle some of the concerns raised in the report about, you might have a situation where a 19-year-old student who's finishing first year has never been allowed to legally go to a club. That's a lot of information and experience that they might have missed in the first year of university. The most important way we can think about reducing that harm is through information, dissemination of credible, non-judgmental information, early season city centre testing. I think we might have just about missed early season, but ahead of the limited festival season that we might get, and having that information available and disseminated to event professionals who won't have had updated market information for nearly 2 years. I saw really good examples of security procedures in responding to people at some festivals I observed. I know the report highlighted some concerns about security operatives who won't have the necessary experience to respond to people, and I think this could be a really important way of making sure that that is not a detriment in the festival, and an emphasis on a settings-based harm reduction. I know that festivals probably are just completely, overwhelmed by navigating potential COVID safety measures, but I think also this still needs to be factored in, just provision of water, spaces to go. And the flip side of this is that I'm concerned that festivals will see increasing prevent as a way of sort of being seen to do the right thing. And I think my concern is that it will have a negative impact for the dark figure of drug-related harm, and that's to do with people not coming forward if they need help. And I think that more consideration needs to be given to the impression that is created on the gate, what that tells people about how festivals respond to drugs. If you put someone through an ordeal of a really intense sniffer dog search operation, is it surprising that maybe they think they'll sleep it off in their tent rather than seeking help? Especially if they're maybe young and don't have much festival experience. And also I have concerns about the sort of ratchet effect that once you start finding drugs and increasing drug fines, it's then very hard to find fewer the next year. And I think it sort of plays into this, this ratchet effect of year on year increases in securitization rather than an alternative approach, which I have observed during my research. So that's a very whistle-stop tour of 4 years of work. I hope that you enjoyed it. Thank you.
My turn to talk on mute there. Thank you very, very much, Verity. That's really interesting. The 3 Ps strategy. I think, really I think that's really great analysis. Really interested in that. So now move on to Professor Fiona Measham. So if you could perhaps tell us about some of the challenges you're expecting for the ongoing work of the Loop. I don't actually know if the remaining lot of festivals which might happen, whether there's likely to be any Loop representation there. So you also have a couple of slides to show us, so thank you. And there's one actually of a question which kind of relates to what you do. So if you have an answer and can slip it into your presentation, please do. Everly asked, with an increase in awareness of COVID harm reduction culture, do you feel a more permissive culture towards harm reduction is likely in the future? So if you've got anything on that to fit in, we'd be interested to hear it as well. So take it away, Fiona.
Okay, thanks for inviting me, and great to hear the other speakers as well. I wanted to talk about the future for festivals, a little bit more than the future of festivals, and think about the festival space and what it is and how it's different. And probably the first thing to say is a lot of people go to festivals, and sometimes if people don't go to festivals, they think it's some fringe alternative subcultural space. So in the Guardian just last week, they said that over a quarter of British adults have gone to at least one festival in the previous 12 months in 2019. And depending on how you define festivals, there can be somewhere between 700 and 900 festivals, and somewhere between 7 million and 9 million people going to them. And just as a little snapshot of that as an indicator, 250,000 Glastonbury tickets sold out in under half an hour last year. So this is not a small number of people at a small sort of subcultural event. And in terms of who goes to the festivals, whilst over half of festival attendees are under 30, and I was very envious, Steve, that your parents took you when you were 10. I didn't even go to a festival until I was over 30. Nevertheless, there's quite a broad demographic. More women than men now go to festivals in the UK. And also, if you look at the bottom right-hand corner in terms of age, whilst the 20-somethings are the predominant age group, I think it's interesting and important to also note that the 40-somethings go along as well, and sometimes that's when they've had children staying with the grandparents, and they go back and reminisce in the dance tent about 20 years ago. In terms of why people go to festivals, they'll say firstly for the music, secondly hanging out with their mates, and thirdly meeting new people, which I think will have interesting significance if we're in a socially distanced festival world. As Verity said, festivals could be seen as sites of atypical intoxication. And what I mean by that is that there's more drug use happening at festivals. Over half of people who go to festivals in the UK report in the surveys that I conduct that they take illicit drugs. And of concern in relation to issues of risk at the festival is that over half of those who are taking drugs say they're going to be taking larger quantities than they otherwise would. And they're also taking a wider range of drugs as well. And people might take drugs usually at weekends, once a fortnight, once a month, or less often. What we find at a festival is people will be taking drugs every day, spread across the 4 days. They don't have the usual constraints of work, home, family, and so on. So it's excessive drugs in terms of larger quantities than usual, more people taking them, and also over an extended time period. And also polydrug use, and the fact that people are mixing drugs together and also mixing with alcohol. And people will be drinking alcohol in ways that they wouldn't outside of the festival site as well. Interestingly, 1 in 7 people say they only take drugs at festivals. So potentially they've got lowered risk. They don't necessarily know what's circulating in the drug market so often. And this might link to the previous graph that I showed you of the 40-somethings who have a blowout once a year at a festival. And so we've got issues around access, easier access, that there will be people who get on site, despite the first of the 3 Ps that Verity talked about. Dealers will get on site, be selling drugs on site. We know from our research that they're twice as likely to be mis-selling as neighbourhood dealers. And we've got higher levels of experimentation. And for some people, able to access drugs for the first time at a festival as well. And so we're seeing more drugs, longer sessions, more drugs taken at the same time. And now we've got the additional risks that Steve mentioned in terms of post-COVID drug markets, disruption to supplies, potentially greater mis-selling of substances. And also this year, we've seen the highest strength ecstasy pills that we've ever seen at over 350 milligrams. So potentially we've got quite a perfect storm there. So in relation to what the Loop does, we're a drug checking service, non-profit NGO that set up in 2013. And since 2016, have been doing drug checking at festivals. We bring a lab on site for rapid real-time testing. We'll have up to 35 chemists. There's a photo of them bottom right, the little sweatshop with all the chemists. And we use a multiple technology model whereby samples will work their way along the lab, and we will do 4 or 5 different types of tests on them to identify as quickly as possible what the substance is. In terms of the legalities, and Steve touched on this a bit, we try to be as legally compliant as possible. So we have them drop off the samples into locked amnesty bins. The substances then are considered to have been surrendered. The police will often be in the lab, and so the samples will be in police custody. We destroy them through the testing process, and also remnants are collected by the police after we finish testing. And we're aiming to test the samples in about an hour to provide some quantitative as well as qualitative information. So it's not the 10 minutes quick qualitative FTIR and reagent testing, And we also don't send it off to a lab for several days. And the reason why we're aiming at that sort of level of testing is because at the busiest festivals, we could be testing 500 to 1,000 samples a day. So it's also about reaching the most number of people that we can. And so the test is the hook to get people in. The real hard work is the consultation, which is with one of up to 35 healthcare staff. And we have doctors, nurses, pharmacists, psychiatrists, all sorts of health professionals who are used to delivering clinical results and used to delivering brief interventions. And they will be located in a tent. Tent does it a disservice, actually. If you look at the bottom left photo, that's at Boomtown 2019, I think. Amazing, huge structure on site, and we'll be near the medics, near other welfare services and psychedelic support services. So the idea is it's a wraparound service for people who are on site. The consultations themselves are very broad ranging, so it's not just about test results. They're free, they're non-judgmental, and they'll be talking about not just polydrug use, but all sorts of different medical issues that people want to talk about. And one of the reasons for this is because almost everybody who comes in to use the service has never spoken to a healthcare professional about their drug use before. So they have a lot of questions, and it might relate to things like interactions with medications or interactions between drugs. Excuse me. Non-COVID cough. Then also we offer a referral to future drug services, and 1 in 20 take us up on that. In terms of the results, I'll go through 3 key results that we've had from our loop services on site. First of all, if we identify adulterants, then we find that over half of people who have a substance which isn't as expected won't take it. They'll either hand it over for disposal or destroy it themselves. And what's interesting is that when we follow people up 3 months later, nearly half said that they're still having conversations with their friends about what's in their drugs, prompted by the drug checking. And over a quarter say that they're still being deterred from buying drugs off strangers. So that experience of drug checking, finding out something has been missold, has really had a deterrent effect in terms of buying drugs off strangers. Secondly, 2 in 5 of the service users whose sample was as expected, so they're going to take a smaller dose in future. So at the brief intervention, we'll have conversations about dosage, about moderation. And also 3 months later, 1 in 5 are still taking smaller doses. So we were really pleased that those sorts of conversations about moderation, which this year more than ever is so important, bearing in mind the vast variations in terms of the strength of substances, carry on after the festival is finished. And the final finding that I wanted to highlight was in relation to if samples were as expected, we also talked to people about the risk of polydrug use, of combinations. And what we found was that 2 in 5 said they'll be more cautious about polydrug use. And 3 months later, 1 in 3 was still being more cautious about polydrug use. And this photo has got the trip sitting chart, which some of you will be familiar with, that there's a real buzz outside, as this quote says, there's a real buzz outside the tent when people are standing outside discussing the trip sitting chart, discussing the impact of the combinations of drugs. And as this quote says, that she took a photo of it, shared the photo with friends, and was still talking about the trip sitting chart long after the festival ended. So I think what I wanted to say in relation to festivals really is that there's quite a lot of downtime in the daytime at festivals. People are hanging around, really keen to be finding things to do inside, out of the rain, which are free, engaging. And I think there are enormous possibilities if we have millions of people, as we do, 7, 8, 9 million people going to festivals, be engaging them in various ways. Festivals are also carnivalesque sites, and the academic research suggests that this is time out from usual social controls, usual behaviours, usual life patterns, and we can really make the most of that, I think, in terms of this altered other space, this alternative space. And that's partly for stakeholders, that they are in access with tens or hundreds of thousands of service users that they wouldn't otherwise be. And these are people who often aren't in touch with services. And Verity mentioned this in relation to policing, but I think also more generally with stakeholders, is festivals are a real opportunity for piloting, for trialling, for doing things differently, just for those few days. So that those services are not necessarily just evidence-based, but also can be evidence-making in terms of thinking about things like drugs, education, staff training, in relation to diversion away from the criminal justice system, thinking about novel healthcare interventions, not necessarily just drug checking, but others as well. But also for festivals, police, security and health, this might be the most drug prolific weekend for them as well in terms of their service delivery. So often we will do demos on site for the police, and they don't come across all this wide range of drugs in the rest of their daily lives and their daily working lives. So it's a real opportunity for staff training, for police, for security and for medics. And I think finally, just to say in relation to people who are going to the festivals, then with this daily downtime, if we've got an opportunity to engage them in all sorts of different ways, we know that if people have experienced drug checking, they seek out drug checking in future. It becomes a reason for going to a festival. And I think there's an opportunity really we've got the time to talk to them, we've got the time to test the drugs, we've got the time to have these harm reduction conversations. But I think also there are wider health and wellbeing services potentially. So I put some of them there, but I think it could be in relation to alcohol, not just illicit drugs. It could be sexual health. It could be all the repercussions of tent sex, about having condoms, access to emergency contraception, cystitis. Lots of women have their worst ever experiences of cystitis at festivals, and in terms of things like mental health, counselling, yoga, whatever. So there's all sorts of other possibilities. And also in relation to COVID, I wanted to flag up, we can engage with millions of people in relation to COVID. How about giving vaccines on site? How about booster shots on site? And finally, to say there's a ripple effect of all of this. We've seen in relation to drug checking, I touched on that, about the 3 months effects 3 months on. But I think also the other conversations in relation to health, to wellbeing, to drugs, to sexual health, to mental health. And I think that we can carry on some of these policy initiatives and some of these pilots off-site as well. So I think festivals are much more than just this music space, which is obviously the main reason people are there. And what I'd like in terms of the future is for us to really be opening up those possibilities.
Okay, thank you, Fiona. That was really interesting. I'm especially interested in your visions for a greater and wider harm reduction, holistic harm reduction, and more than harm reduction. I've lost the word I'm looking for. When you the holistic focus you're thinking of with festival provision. Well, we still got you, Steve. I'll move back to you. So firstly, I don't know if you've got any responses, anything you'd want to build on any of the 3 speeches we've heard so far.
Well, yeah, I mean, gosh, so many things. I mean, look, Anna, your point about the events research program, and I said, that we do take some credit for trying to get the festivals into the ERP, but I mean, just this week, actually, on Tuesday, there was questions in the House about the ERP, and the minister said that there were no major concerns that resulted from these events, but we still haven't seen that data. It hasn't been published. And I think it is not unreasonable to ponder whether that data undermines the delay from the 21st of June to the 19th of July. My job is to ask questions, and I will ask questions of the data. So I thought it was interesting you made that point. Furlough and that being extended, and then the next round of support around rates and all of the other support that this is costing the Exchequer a fortune. The Exchequer, otherwise known as you, the taxpayer, and we cannot carry on like this forever, which is sort of the wider point and why I did not support the extension from Freedom Day to what is apparently now Terminus Day, because this is an endemic disease. The Chief Scientific Officer said that months ago. We have to understand that. We cannot live in fear of the next variant. There will be more variants. 6 to 7% of the world population have currently been vaccinated. Therefore, COVID is able to have a party, and it will multiply and it will mutate, and that will make its way here. And we know that the efficacy of our vaccines is good. We have long ago vaccinated the vulnerable. We've long ago even double vaccinated the 1 to 9 groups. And very, very soon, even youngsters like me have had 2 jabs. Either we trust these vaccines and we believe in them, or we don't. If we don't, different conversation. I thought the point about risk and harm, James, that Everly put in the chat was really interesting. This is what that goes to the heart of all of this. You know, are we a too risk averse culture? You know, if we wanted to ban smoking, we could take 90,000 deaths every year out, but we don't do that. So the thing about risk and about harm, I mean, and is that going to lead to a different approach? Well, I just look at the response in some of the press to our report around drugs. A Home Office spokesman said, this was in The Guardian, there is no safe way to take illegal drugs, which devastate lives, ruin families and damage communities. Any policing arrangements around festivals are an operational matter for chief constables. Well, you know, yeah, there's no legal way to take illegal drugs, but there are safe ways to recognise that it's happening and to face society as it is, not as we want it to be. And so this then takes me on to Fiona, who once again proving why I big her up as I do and why I'm so impressed with the work that they do. You know, the minister said to us in her evidence, Fiona, you were listening, that there have been no conversations, quote unquote, between DCMS and the Home Office to discuss the learnings from what's happened in New Zealand. And she repeated the view. You see the line here: no illicit drug can be assumed to be safe, and nobody is assuming it to be safe. That's the whole point of the loop. So I would say this though, is that it's not just about government. SAGs, so that the safety advisory groups and obviously that sit within local authorities, they need to join the enlightenment too, because there are lots of festivals that are frightened to embrace what you do, Fiona, and they're frightened to do it because they think the message that then sends to the SAG is that they're not a safe event and they're a risk. And SAGs are then too risk averse, to go back to that word, so they need to embrace this too. And that is not just, so it's not just about national government. That there would be my initial reflections, James.
Great, thank you very much for those. And I understand you probably will need to drop off soon, so I'll thank you again.
In about 10 minutes, yeah.
Oh, yeah. 10 minutes are excellent. So if everyone else is okay to go on for a bit longer, I will continue. So probably possibly move back to you, Anna. So if you have any reflections on what you heard from Verity and Fiona, would love to hear those. And if not, specifically, I must have got any views on this kind of the very holistic ideas for future festival provision that Fiona put forward.
Yeah, absolutely. Thank you. And yeah, thank you for everyone. It's been really interesting hearing all your insights there as well. Obviously, with Boomtown, we brought the loop on to offer harm reduction services back in 2017, and we managed to offer front of house services in 2017 and 2018. And Fiona and I have worked really closely with each other over the years to try and get that messaging really right. And one of the things, going back to Verity's 3Ps, that absolutely was the biggest game changer from my point of view, from Boomtown kind of audience interaction, being able to speak with people, because previously it was like the zero tolerance. We're absolutely not, like, it just doesn't happen, drugs don't come into the festival, just say no. You know, like it basically stifled conversation. The minute we changed it, ours was actually the 4P, so I'm not sure if they're quite the same thing or not, but that made it this holistic kind of, we're going to approach it with a 360-degree view on everything. So although we did have the sniffer dogs at the gates, we had the amnesty, so the whole prevent side of things, we did also have all of these harm reduction and welfare provisions on site as well, which the minute that we offered that and we actually opened up a conversation, we realized we were in such a more positive position than we'd ever been in before, because previously you just had to kind of pretend it wasn't there, treat it as a criminal matter, treat it as a medical matter, without actually getting in at the source and being able to have these really grown up, really important like interventions and awareness raising moments. And that model that we did with like find an issue, provide a solution, has actually kind of set the blueprint for loads of other things that we've done in Boomtown. Like we've even done that now with our like sustainability side of things. So, you know, we have a huge amount of campsite waste left behind. How do we resolve that? How do we support people to take their stuff home or change behavior and things like that? And I think from the work that we did with the loop, that really has reached out to beyond the harm reduction side drug conversation. It is this holistic kind of approach. And I think that Fiona's idea there is really wonderful, and it's something that we do also offer on a lesser degree, but at Boomtown as well. So we have the loop next to the welfare, next to the medical. We have the roaming mental health support teams. We have the roaming drug awareness teams as well. And a lot of the welfare, chill welfare, the people that we work with, and I know Fiona's worked with them on quite a few of the shows as well, and they have such a brilliant service that they offer in terms of sexual education as well. So there is a lot of that, and I think somebody's mentioned in the chat as well about the fact that it's so important for festivals to prioritise welfare and the customer safety, and I think, as we've said, there's quite a few, like festivals are primarily there for music, for fun, for entertainment, for escapism, a Boomtown theatre and all of that kind of side of things as well. But when you're bringing over 60,000 people together, or thousands of people together, even at a small festival, safety still, you have to look after people. You're creating a small festival, a small city. So to offer those provisions has been something that actually, from a Boomtown perspective, we've been really proud of being able to do that and to prioritise that as such an importance to people's overall experience. It's not just about the hedonism and the fun and that side of things. It's the whole experience and keeping people safe. So definitely, I just agree. It's like Verity's research is really, really, it absolutely tells the story of what we've experienced on the ground, and Fiona's presentation as well is all in line with everything that we've been doing from a Boomtown perspective. And I just hope that in 2022 we'll be able to bring back front of house checking in that really impactful way. I think that both Fiona and I were actually quite pleased, weren't we, with the fact that even in 2019, when we weren't able to actually offer the actual drug checking service, there's still the intervention and the conversation and that approach, and that chart that Fiona has. It's such a brilliant conversation starter, and I think that is the key to all of this, is that we're enabling conversations to happen, and that is the bottom line of all of it, I think.
Okay, great, thank you, Anna. Verity, it's okay to ask you. So you talked about the different approaches you saw at festivals. You talked about what you saw as some of the negative outcomes of the very heavy sniffer dog scaring the life out of everyone sorts of policing. I wonder if you can perhaps say a little bit about some of the different atmospheres you felt across your research sites. Obviously, won't be asking you to name names of the festival research sites, but I wonder if you've got anything to say on the differences in approach, differences in atmosphere, differences in outcome, perhaps.
It's better. I think the one thing I would say is that across all my fieldwork sites, there were really different approaches, even if on paper they read the same in terms of searches, amnesty bins, sniffer dogs. And I think that really spoke to the different perceived risks associated with the audiences that they were targeting. And there was one festival site that did do things very differently. And actually, they didn't have a 3Ps policy. I think I'm sort of using them as a sort of antithesis to my general sort of structure, and their approach was a general harm reduction approach. And they didn't have drug testing on site, but there was a real emphasis in festival culture and creating a really welcoming environment as the audience entered the festival, and creating a culture in which people would feel comfortable, say, reporting if they saw anyone on site who they thought wasn't within the spirit of the festival. And I don't think that this would necessarily fit all festivals. I just think it's a really good example of how it can be done when there is investment in culture. And I think that it was greatly facilitated by really intense and respectful relationships between the police and the festival. That was the foundation of them being able to have this approach, which sort of flies in the face of most of the other fieldwork sites, which really were sort of heavier on prevent, and welfare sort of came later. There was so much more heavy investment in welfare, in medical facilities, and in looking after people and creating this sort of environment where people felt comfortable, happy, and looked after. So it can be done differently. But yeah, it's sort of very context dependent.
Awesome, thank you very much, Verity. So I think I'm just going to have 2 more points to be given before we tie up. So I do have one more question for you, Fiona, but first I'll move back. I think Steve would like to give us one final point.
I just wanted to say before I go, you know, we heard from I said earlier that we heard from the police, National Police Chief's Council lead for drugs, and he told us in our work that they reckon 40 to 50% of the stewarding on festivals that take place going forward will not be the same as they were 2 years ago. So therefore, there is a real loss of the expertise of dealing with those experiencing drug-related harm. That could create a risk too, as well as the potency of the drugs and the tolerance of the users. So that is a concern for us. I think just because I can well imagine the tabloid coverage of this discussion, which will be tedious and take us back to why we have this problem, is that we are not arguing for a free-for-all where people can take that, like, do what they want, the alternate 1984 in Back to the Future. That's not what we're arguing for. What we're saying is that festivals are not the problem. They can be part of the solution, but we need local government and national government to help with that. All festivals is a gathering of largely young people, but also old people like me, but they are a gathering of people in a different location to, say, the city centre where they may go when it's not a festival weekend. And those harms are the same. So there was a conversation in the chat about from a GP talking about, you know, seeing the harm reduction work that Anna's talked about, that she's seen in her work. That's what this is about. It's about harm reduction, not just about festivals, about within society. And, you know, this year, the Misuse of Drugs Act is 50 years old. The aim of that act is to deter unlawful controlled drug use and stifle supply. Well, if anybody thinks that it has done that, you know, let me know. You know, despite substantial resources invested in drug control strategies, drugs are cheaper, they're more available, they're more potent, they're more widely used, and we've missed new treatment opportunities for a wide range of illnesses and within the life science industry over years. This is not a criminal justice issue. It should not be within the Home Office. It should be within my old department, the Department of Health. And I used to argue that within government privately, and I argue outside of government publicly. And then we might have a more enlightened response to this, because as long as we carry on as we are, you know, it is the definition of stupid. We will get the same answer, and people will die, and I don't want to see that happen.
Okay, thank you very, very much for that. And so now, before we go, I think I will bring it back to Fiona. Now, so just wonder what we should expect to come from the Loop. So firstly, I don't know if there will be likely any Loop presence at the remaining festivals this summer. I'm wondering how you expect growth to go in 2022 and kind of what your direction of travel was before, of course, COVID stopped things in its tracks. And yeah, what do you think the likely kind of barriers are and some of the opportunities for you to grow once life and nightlife and summer festival life starts to get back to normal?
Okay, well, we've been invited to some festivals this year. Some of the festivals are going ahead, some aren't. We've been invited to Boom Village. Thank you, Anna. And so we are hoping to be at some festivals doing some sort of service this year. It remains to be seen exactly what that will be. And what we're hoping to do is be expanding the city centre testing, because as Verity said, there's an opportunity to be providing testing services before and outside of festivals, and lots of people don't go, the majority of people don't go to festivals, so we want it to be as inclusive as possible in terms of being able to be accessible to as many different drug using groups. But I think in the longer term, of course, the Loop is staffed wholly by volunteers, is that we want this to be established health service which is suitably publicly funded and doesn't just rely on the donations of small amounts of money or the donations of time from the professionals who work for the Loop. And what we'd like to show is that, because we can show that it works now, without a doubt that we can reduce harm doing it. What I'd like to show next is that we can save money. This is about prevention, that we can reduce the numbers of people going to hospital and hopefully also reduce the numbers of drug-related deaths, so that we can show its value for money, and we can save money by having drug checking services a lot in the sorts of scale that we have in the Netherlands, where they've had it for 30 years.
Okay, great stuff. Thank you very, very much. So I don't know if anyone else has any final points they would like to make, or has any responses to anything in the chat. Say raise your hands if so. If not, I think I will say my thank yous to you all then. So here's a support to Steve Bryan MP taking your time out for this. Really encouraging to hear what you have had to say today. Thank you again, Anna, and best of luck with Boom Village. All of our fingers crossed for that, and for all your work going into 2022. Afterwards, thank you very, very much, Verity, for that, for all the research you've been doing for your presentation, and best of luck your research going onwards. And finally, thank you very much, Fiona, for the presentation and for all of the loops so far. And yeah, we hope to see it ever more. And yeah, I look forward to witnessing my first city centre loop as that pops up. And yeah, of course, thank you to everyone in the crowd as well. This will go up on YouTube eventually. I will very quickly post the YouTube channel into the chat, so you can follow that to see our 9 previous talks, as well as this one when it goes up probably in a week or so. So thank you all. As I said earlier, you might have missed, we are going to take a break in July and August, which is partly because most of the organisers are moving house and we've got too much on our plates, and also I think everyone's Zoom fatigued and it's summer and all as well. So yeah, thank you very, very much. Look forward to seeing you all, future events, future webinars, future anything else. So yeah, thank you. Have a nice afternoon, evening. Hope to see you again soon.
Thanks, James. Thanks, everyone.
Thank you. Bye, everyone.
Nice. Well done.
Great.
Thank you. Thank you very much, Phil.
Cheers.
Cheers.
Cheers. All good your side, James?
Yep, all good. I think that was enjoyable. I think that all went well
Yeah,
enough.
yeah. No, it's really good.
Cool.
Yeah,
No.
encouraging, and really excited to see where the space goes.
Yeah.
Curious,
Yeah,
because
it's
I really out to a festival really, so there's purely selfish intentions here.
Indeed. I think all licking our lips for 2022.
Yeah.
It's quite interesting. We will see. We will see. Yeah, I will report back to you and let you know how Balta goes and whether it's just complete. So I'm guessing by September, probably not much distancing. I don't know, but yeah, I'll report back and let you know how that goes.
Yeah, it all really depends on what Steve was saying, in a sense, is that if the variance thing becomes a bit of a bigger deal than it is right now, we could see even more restrictions in some sense. But I guess it's curious to see where that goes.
Yeah, all lots of unknown. But yeah, to be seen. So yeah, I will let you get back to your day. I'm just kind of want to go out for a pint, but it's absolutely pissing it down, so I might need to reaffirm whether it's worth getting a taxi to it.
It's probably not